Fellow Guyanese, welcome to another COVID-19 update. I'm Dr. Shamdi Opasot, Chief Medical Officer. I wish to inform you that our COVID-19 cases continue to rise. It is unfortunate that I announce Region 2 has recorded its first case. We now have 8 out of 10 regions reporting COVID-19 cases. As of the 16th of June 2020, of the 36 tests conducted, we are reporting 12 new cases. This brings our total number of confirmed cases to 171 and the number of COVID-19 deaths remaining at 12. The total number of tests done is 1,995, and of that number, 1,822 are negative. We have 60 active cases in institutional isolation and 24 cases in quarantine. We are happy to report that 99 persons have recovered thus far. We continue to call on our mining communities to recognize that you can only be safe if you always follow the guidelines of wearing a mask when you are in public, washing your hands as often as possible, and maintaining physical distancing. Please remember that there is no cure, so the temptation to self-medicate if you have symptoms of COVID-19 is not recommended. We ask that you seek medical attention by contacting the nearest health facility so that they can bring services to you. The message is not only for the miners within the hinterland regions, but for those who are at home and on the coastlands and have plans of returning. Please remember that you cannot provide for your family if you are sick. Now for the global report. According to the WHO, the global statistics are as follows. The total number of cases is 7,823,289 cases, with 431,541 deaths. In the region of the Americas, the total number of positive cases is 3,781,538, with 201,848 deaths. Fellow Guyanese, I wish to continue my conversation that I began with you yesterday concerning those residents who are repatriating. These are the procedures that will apply to any traveler, citizen, resident, worker, or visitor arriving by commercial or private aircraft to the 2 main airports in Guyana. A summary of the criteria for travel by air as stated in the IATA Biosafety for Air Travel is outlined below. PCR testing for COVID, temperature and symptom screening, and the use of PPEs. Today's focus will be on pre-screening. Pre-screening before travel. Persons returning by airlines will be screened at check-in and boarding by the airline. Temperature, symptom checks, health assessments, and other COVID-specific exit or entry screenings will be applied in accordance with IATA's guidelines. Travelers should provide proof of negative PCR tests not more than 48 hours before traveling. If testing is done on the same day, tests must be done by the PCR method, and the travelers must arrive at least 6 hours before the departure of the flight. Practice physical distancing during boarding, at least 6 feet or 2 meters, and use of personal protective equipment where necessary. Boarding is recommended to commence from the back of the aircraft, with each passenger seated before the next person enters. Persons needing special assistance should be boarded before other passengers. Passengers should be encouraged to use the restroom at the departing airport before boarding. Do remember to call our hotline, use the mobile units, or one of the COVID-19 facilities if you're experiencing any symptoms of COVID-19, or if you have been in contact with someone who tested positive. Fellow Guyanese, we must work together and build synergies to protect our communities. Be strong, stay safe. I thank you.